the first of our competitors. And this is going to be Vicky Griffiths, who's a cardiac physiologist from the Royal Brompton, and she's going to tell us about stents.
I'm going to tell you a bit about why stents are so great and why they ought to win the competition today. Essentially, the arteries that supply the heart with blood, the coronary arteries, need to flow nice and clearly. Otherwise, you end up getting horrible symptoms like chest pain, shortness of breath, and basically not being able to live your life very comfortably. On the right-hand side of the screen there, you'll see at the top a normal artery where the blood can flow nice and smoothly, and at the bottom you see one where there's a fatty deposit that grows on it and narrows the vessel down and doesn't allow the oxygenated blood to get through. And if the blood can't get through and the heart itself doesn't get a good blood supply, then the heart muscle dies, you have a heart attack, and that's not a very good thing. In the good old days, the way to fix these blockages was fairly dire. You would take a piece of vessel from the leg or even from the arm, and you would graft it onto the heart to bypass the blocked part of the vessel. And this was quite gruesome, really, because as you can see in the top left, basically you used to take the vein out of the leg and lots of horrible scarring. Things have moved on since then. You can make smaller holes, or you can take the vessels from somewhere else. But the reality is that even today, the chest requires to be opened. You need to cut open the chest and break the breastbone and go right in to get to the heart, which is a big operation. It involves a general anaesthetic with all the risks therein. You can be in hospital for days. Even now, it's 4 to 7 days. It takes a long time to recover. And imagine how painful it is having had your chest bone cracked open to get back to normal, even just moving and getting up out of bed. And there's a risk of more complications. You might get an infection and all these big wounds, and it's very, very invasive and affects the way you live your life for quite a long period of time. But that was until coronary intervention came along. In the early days, we started out with just a balloon, which was passed over a wire into the heart and was blown up to open up the vessel. And this was great. It was a huge advance. They're nice and small, and you can get them right through the blood vessels to exactly where they need to be. And then once you get them there, you open them up, and they help the vessels stay open. The bad thing about this type of stents, which were just made of metal, was that they tended to clog back up again. So it wasn't so great. So the next development was to put some drugs on them, a drug that helps interfere with the process that causes them to clog up again, and enables them to settle in and stay nice and open, or patent, as we call it. Nowadays, we focus more on getting the stents that are nice and flexible. I'm sure you might all have seen one of these in your time. And modern stents look not unlike a slinky. They're made out of one big piece of metal with the relevant bits passed together, and it allows them to fold up very small, and then once you get there, to coil round bends, because you saw from my original picture, the heart isn't nice straight lines. It's all nice and curvy. So flexibility is the name of the game, to make them smaller and easier to go where they're going. Bioabsorbable stents, these are a great idea. Rather than having bits of metal that you don't need in there, you have stents which are bioengineered, so that once they're in place and the heart has remodeled itself and the vessel's going to stay open, the stent itself just drains away, and then you don't have any hardware in there that you don't need, and you can go back in again at a later date if you need to. Bifurcated stents, these are stents which are like little trouser legs. If the narrowing happens to be on the bend in the vessel, then you can end up not being able to get where you need to go. So stents like little trousers are one of the places we're going. Whoops, there we go. So the future improvements that are already on the way are in how the drugs are delivered, to deliver them more quickly, to deliver them in a different way, to make them it all happen quicker, and also to see the stents that are not made of metal. The difficulty with the bioabsorbable ones is that you can't see them or where they're going. So the main benefits of this type of technology over the surgery are that you can just pop them up a tube that goes through the leg or the heart, through the arteries that lead to the heart. It's a local anaesthetic, so the patients are awake and they can be talking to you during the procedure, and that's nice because they can tell you straight away. The great thing about this is it's immediate. If you open up the blood flow to the heart, the patients who've been lying there screaming in agony because their chest is painful and they can't breathe, it's amazing when you open up that vessel and that patient immediately says to you, "I feel better." The stay in hospital is a lot shorter, it's only a day or two. Your recovery is much faster, you can get back to normal living almost straight away, and there's much less complications from making a small hole in the leg than there is through making a big hole in the chest. Lots of people benefit from a coronary stent. You can see on the left the miserable so-and-so that is Harry Redknapp. Most of the others are quite happy about it, such as Prince Philip and Bill Clinton. But essentially 65,000 people every year in the UK alone benefit from having a stent, and that's more than 2 million people in the whole world. And it's not just old famous men, it's also ladies. Coronary artery disease affects about 2.6 million people in the UK every year, 94,000 of whom will die, and about 20% of them are men and 14% women, so that's an awful lot of people. And the question I'll ask you is, how many of you know someone who's had a heart bypass or a coronary stent or even suffers from angina in their day-to-day life? I bet it's quite a few of you. When we put the stents in, we look at them on X-ray, and this is a picture of the tube coming down into the heart and injecting some dye, which shows up on the X-ray, into the artery. This is a genuine picture of a lady who came in a week ago, crushing chest pain, short of breath, and straight off the streets, out of the ambulance and into the hospital. So this is the right coronary artery that should wrap around the heart, and you can see from the picture that effectively it just stops dead a couple of inches in. After placement of a couple of stents, where we pass a wire down through the vessel, pass the balloon over that, blow up the artery, and then pass the stent down and blow that up, and then release the stent so that it stays behind when the balloon is pulled back out again, you can see that the vessel there is completely open, and this lady felt instantly fabulous. So I argue the case for stents because it's good for so many people. You have instant results, and frankly, I did last in the last round, so I'd like to be better than that this time. Thank you.
I mean, think about it. There's 2 million people in the UK, right, who suffer from coronary heart disease. 65,000 of these little devices are put into people every year, 2 million worldwide. And the amazing thing is that there's not very much to it in a way. It's simply a very cunningly wrapped little wire that you can essentially feed through. Think of the alternative, right? Basically having to snip through the chest to open it up, do the work, and then close it again. And instead, this can be done remotely almost by passing it, by threading it through. I think this is a very, very strong contender today because it's so, so simple and so powerful.